Hi, it's my At the End of the Day podcast. I'm Dr. Cameo Carter. I'm a pediatrician, a mom, and a small business owner. And this is a few moments I take at the end of my literal work day to talk about various things that are on my mind. What I'm seeing at work, what's weighing on me or percolating in my brain, and sometimes what I think we need to do differently. Recently, I had the great opportunity to join Congressman Pete Aguilar at a press conference he held to talk about how the expiration of the ACA premium tax credits is affecting families in our community. And I was genuinely grateful to be there because this isn't abstract to me. I see the impact every single day in my clinic. I hear it from parents, and I feel it very personally in my own life. Families are losing coverage. Premiums are rising. Out-of-pocket costs are overwhelming. And I want to say this clearly because people often assume otherwise. Even as a physician, even with a stable career, the cost of healthcare is really difficult for my family as well. As a self-employed small business owner, I pay $3,500 every single month for a very basic family health insurance plan. That's $42,000 a year, and that is just the premium. That does not include deductibles. It does not include coinsurance. It does not include copays, prescriptions, or surprise bills. That is simply the cost of getting to hold an insurance card. So yes, I absolutely agree the ACA premium credits need to be reinstated. They matter. They influence the rates of insurance coverages for everybody. They help families regain coverage who aren't able to obtain it. They slow the damage. But here's what I couldn't stop thinking about after that press conference. During the event, a reporter asked Congressman Aguilar what a good healthcare system actually looks like. And the congressman's answer focused on affordability by restoring the ACA premium credits so people could buy insurance again. And I understand that answer. It makes sense in the short term. But here's the truth, we don't say enough and we don't talk about enough. Even when those credits existed, families were still struggling. Before they expired, families were still paying thousands of dollars a year in premiums. Deductibles of $5,000, $7,000, $10,000, even more were common. Parents were still delaying care because of cost. Doctors were still fighting insurance companies for basic evidence-based care. So while restoring the credits makes sense as a bridge, they cannot be the destination. Why should we keep limping along in a system that was already broken? If this were a patient, and I say this as a doctor, I'd be honest. Our healthcare system is hemorrhaging. We're already gravely injured before the premium credits expired. Their expiration just intensified the bleeding. And when somebody is bleeding out, you don't just apply pressure and walk away. You slow the bleeding, and then you fix the underlying injury. The credits slow the bleeding. They do not save the patient. To save the patient, we need a new system. So here's what I want to dream think with you today, to put forward, not as a bill, not as a policy memo, but as a clear expectation and thing that we should expect. I believe every child in America should be guaranteed health care. That means all well visits provided, all vaccinations, primary care, mental, behavioral, and developmental care, with no deductibles, no coinsurance, and no surprise bills. Automatically, from birth. No applications, no qualifying, no fear. Because if we continue to not be able to agree to protect children in all kinds of ways, then we've again proved that we've lost our moral center. And here's what people don't always realize. starting with children, isn't just ethical, it's practical. Once children are guaranteed care, the logic becomes unavoidable and expansion can continue. That's how an idea like this grows. Children first, then parents and caregivers, then the rest of the adults, until healthcare is simply part of living in this country. That's not radical. That's how durable systems are and have been built. Through experience, through growing things, not just an ideology. Think about what we already expect in a functioning society. If there's a fire, firefighters show up because we pay our taxes. We expect clean water. We expect roads to exist. We expect sewer systems to work. We don't shop for a fire department while our house is burning. Healthcare should work the same way. It is not a luxury good. It is not a perk of employment. It is infrastructure. And in a civilized society, it should be a right and a guarantee. Now, whenever we talk about guaranteed healthcare, this is where people sometimes get stuck. They say, but my taxes will go up. Yeah, they will. But here's the part we never explain well enough, and we really need to emphasize. Those taxes replace what you're already paying. They don't stack on top of it. Right now, Americans pay for healthcare in the most expensive, fragmented way possible. You just don't see it as one clear line item. A typical middle-class family today pays maybe $1,200 to $2,000 a month in premiums. And this is me being conservative. I mean, there's lots higher numbers too. Thousands more in deductibles and lots more of out-of-pocket costs. And if you're employed, your employer is often paying another $15,000 to $20,000 per year for your insurance. Money that could have gone to wages, flexibility, or benefits. When economists add this all up, the average American family is spending well over $20,000 to $25,000 a year on healthcare. And for self-employed people like me, there is no employer contribution. I pay $40,000 a year. I pay $42,000 a year just to hold an insurance card. And I still have deductibles, co-pays, and co-insurance on top of that. That is not sustainable. And I am far from alone. In a universal system, these costs disappear. No premiums, no deductibles, no co-insurance, no co-pays for standard care, no surprise bills, no network penalties. Instead, you pay one predictable income-based contribution through taxes. So yes, taxes go up, but your total healthcare spending goes down. Let me make that concrete. I'm going to be conservative. I think the savings could actually be much more, but let's take a household currently paying $1,500 a month in premiums. That's $18,000 a year. And if we add $5,000 in deductibles and out-of-pocket costs, that family is spending $23,000 a year. Now imagine that same household pays an additional $8,000 to $10,000 a year in healthcare taxes. That sounds crazy and scary until you realize they no longer pay premiums, deductibles, or copays. Their net result is $10,000 to $15,000 more in their pocket every year. That's net. And that's not a fantasy. That's how replacement works. And when healthcare costs become predictable and affordable, something else happens. People breathe, people move, people take risks. When healthcare costs are unpredictable, people stay in jobs they hate. They don't start businesses. Small companies can't compete. Families delay care. But when healthcare is guaranteed, workers are freer. Small businesses thrive. Entrepreneurship increases. Wages rise instead of premiums. Money stays in local economies. Universal healthcare isn't just health policy, it's an economic freedom policy. Now, also, whenever healthcare costs come up, someone inevitably points to doctor salaries. So let's talk about that honestly too. Yes, you'll hear an average or median physician salary quoted, but that number hides massive disparity. A small number of very high earners skew the average upward. Meanwhile, pediatricians, primary care doctors, for example, are dramatically underpaid relative to the value they provide. Pediatricians are not driving healthcare inflation. Primary care is not where healthcare costs are exploding. In fact, countries with strong primary care systems spend less overall, have better outcomes, and pay frontline doctors fairly. Underpaying prevention is one of the reasons healthcare costs spiral later. And real healthcare guarantee must correct this imbalance, not replicate it. Doctors who provide prevention, continuity, and care for children must be paid more, not less. And this brings me to something I feel really strongly about. Doctors, not insurance lobbyists, should be designing healthcare systems. Right now, insurance companies shape care by deciding what's covered, how long visits can be because of how much they're paying for, which medications are allowed, and when care is delayed. They profit from complexity. Doctors don't. Doctors benefit when patients are healthy. That's why doctors should help design the system, and lawmakers should follow that vision if they want our votes. And that's the key point. This really doesn't start in Congress. It starts with us, with doctors saying this system doesn't work and we can design something better, with parents saying healthcare for children should be non-negotiable, with voters saying we will elect lawmakers who commit to a healthcare guarantee and we won't accept less. We already expect our tax dollars to put out fires, maintain roads, and deliver clean water. So why wouldn't we expect them to protect our health? I was grateful to stand beside Congressman Aguilar and talk about restoring the ACA premium credits. They matter, they help, they slow the bleeding, and they need to be reinstated. But we cannot pretend they are enough. We were already broken before they expired. If we truly want to heal the system, not just stabilize it, we need to aim higher. Healthcare should not bankrupt families. It should not trap people in jobs. It should not depend on luck. Healthcare should be a guarantee. And if our lawmakers want to represent us, they should be willing to make that happen. At the end of the day, this isn't radical. It's responsible, it's humane, and it's long overdue. Care works best when it's guaranteed, and I think it's time we start acting like that's non-negotiable.